LingGu, DaBai, small intestine 3 and 4.
And we'll do SI joint point too, right?
Okay. You said you needle them toward underneath the tendon, right? Kneading one another?
Oh, underneath the bones.
Yeah, the bones, yeah.
Yeah, I think, doesn't everybody do them that way? No?
Some people.
Yeah. So we're trying to get these, you know, towards each other.
Oh, no.
Yeah, hands are sensitive, sorry. So because we want to get around this metacarpal, we want to get a little bit underneath it. So you could needle it here in this direction, perpendicular, but if you want to get it towards SI, you have to come a little bit farther down, maybe there, right? If we go slow enough, it's not going to react with her too much. Very nice. Okay? LingGu. DaBai is basically SI3, or Li3, sorry. We ran into our... Okay.
That finger.
Very brave. Is it calming down?
Mm-hmm.
SI3 and 4. Here's SI3. Did it calm down?
That one's really gentle. Aye.
Good job. Last one here. She really will get me later.
Wow. I don't think I ever had it
So yeah, it's pretty tight right there.
before.
But you would, if someone's in a lot of pain, you just keep going on SI3. We'll be nice to her and leave her like that. So, SI joint point.
Where does that go?
Look at this one's easier. Not as much nerve here. Lots of nerves in the hand.
Do you see how chicken I am with needle?
You're doing pretty great,
Very
actually.
good.
So, ulna, right? On the edge of this ulna, lateral side, there's a little hook that comes out. In fact, let's find a hand. Can we find a hand? Can we find a skeletal hand to show us what the ulna looks like? Hopefully it's on here. It is. Come with us.
Help me, Tony.
Yeah. So, oh, I'm on the wrong side. How did you get rotated? What's going on here? Oh, that's fair. So we're looking at the back side here. And here's our hook. The little hook. It's actually a little bit rotated. So it should be turned a little bit more, but it sticks out that direction. So we're trying to go through on the inside of this hook. Right?
This way?
Yep. Exactly. Straight through to heart 7 on the bottom. Right?
Oh.
So we're going straight through. So depending on people's wrist bones, they could be like this and you can't get through. They could be, you know, lots of space, tons of room. You can get a truck through there, right? Mm-hmm. But usually there's a millimeter or so, which doesn't give you a whole lot of playroom. So we're looking for this bony prominence. Then we're looking for the tendon that runs next to it, and that's our bone, right? Our hook. And we come just medial to that, right? So see where the fingernail went, right there. Yeah. So that's where we're going.
Oh no.
It's not so bad this one.
You should have.
You can needle me.
Yeah, you need to look that.
Needle someone else?
No, it's okay.
You'll be fine. This one's really not a lot of nerve to it, so just here, right? Sometimes that's enough because you end up in some ligament already because it's just right on the surface. But usually we try to get it down to heart 7. So I usually put my finger down there, just medial, just a little bit distal to heart 7. And we're just going to do a little pressing, slow, firm pressure. And she's got a tight space, so we're bending our needle a little bit. Not happening today, baby.
It's not going in on it.
I might be too proximal actually. I think it's a little bit more distal. Let's try a second one. Oh, yeah, it's okay. Not painful.
Otherwise, I would scream.
Is this the one you injured?
Yeah.
Oh, could be that it's just jammed up because she injured it.
From yoga?
So sometimes, yeah, this is the one that hurts actually, isn't it, when you do your plank and stuff?
Mm-hmm.
Yeah, she's tight on this side. So sometimes when you get those patients that are really tight, you just can't get them through. So an alternate way to do it is you can look for the tendon, which is there, and then you can come just laterally through to SI5, right? So you can go lateral, angle laterally, and we're still going to get through some ligament. Quite tender, baby girl. It's just too tight on your joint.
Yeah, that's
here.
the one that they injured.
Let's do it on someone else. Yeah.
What are you using that point for?
SI joint pain. Yeah, into the ligament. So, yeah, you've got a
Where we
nice.
marked
Yeah,
it.
you've got a mark. It's a little bit. You're a little high here, so it's there.
Oh.
Yeah, it's a little bit lower. That one. Yeah, perfect.
So that means if I'm your patient and you go to your clinic, you can't needle that part, can you?
I would needle it from the bottom. I'd try a third time.
Oh.
Yeah. More sirens. And there we go.
Did it go in?
Partially.
Wow.
It's stiff on you, Tina, but that's okay.
Yeah, I have a wrist problem too.
Is that okay? So if you can see the tip of the needle there, there,
Oh, wow.
yeah, it goes right through the space. So
So.
Oh, yeah.
Can you see it?
right,
Like you
Do
still
it
cannot
again.
see. No, you can. It's coming out right here.
can you see it,
That's the
Sam?
needle end.
Yeah, turn it.
What is this? Right. And there's some dense tissue through there, right? So if you're using a thicker needle, you don't have to worry about choking up so much on it. But if you are using very thin needles, they will bend as you go through. But not painful, really.
No, no.
No. There's not a lot of nerve there, so not a ton of pain. If you get it really angled towards heart 7, you might catch that ulnar nerve a little bit. So they might get a tingle from that, but that's kind of rare, actually. Usually that's it. So